Why does your child seem mostly okay during the day, but then starts coughing much more at night? Many parents notice this, and sometimes it can be completely normal. But in some children, it can also be a sign you should not ignore. Welcome to Clinic Explain. I am a practicing pediatrician, and in this video, I'll explain why nighttime cough happens, what is usually harmless, and which signs means your child need medical attention. First, a cough that gets worse at night does not always mean something serious. In many children, nighttime cough becomes worse because of body position, mucus draining backward, dry air, or sensitive airways. But the most important thing is this: do not look at the cough alone, look at the whole child. A very common reason is post-nasal drip. When your child has a cold, mucus from the nose and throat can drain backwards, especially when the child lies down. That can irritate the throat and cause more coughing during the night. This is especially common if your child also has a blocked nose, a runny nose, or recent cold symptoms. Another important reason is airway sensitivity. Some children cough more at night because their airways become more reactive. This may happen after a viral infection, or it may keep happening again and again. In some children, repeated nighttime cough can be a clue toward asthma. This becomes more important if your child also has wheezing, cough after running, or repeated episodes over time. Sometimes the reason is much simpler. Dry air, dust in the room, strong fragrances, or smoke exposure can all irritate the airway. At night, that irritation can become more noticeable, especially in sensitive children. Now, if the cough sounds harsh, barky, almost like a seal, especially if it suddenly gets worse at night, think about croup. Croup often becomes more noticeable after bedtime. It may also come with a hoarse voice, noisy breathing, or visible distress. Now let's talk about the red flags. A cough becomes much more concerning if your child is having trouble breathing. Watch for fast breathing, chest pulling in under the ribs, nostril flaring, or grunting. And if your child cannot cry, talk, or settle comfortably because of breathing difficulty, that needs urgent medical attention. Also seek urgent care if you notice wheezing, a harsh whistling sound while breathing in, blue lips, unusual sleepiness, poor feeding, or if your child simply looks very unwell. Parents often notice this first, and that instinct matters. If your baby is very young, especially under 3 months, even a cough deserves extra caution. Young infants can become unwell more quickly and should usually be assessed earlier. If your child is breathing comfortably, drinking reasonably well, and otherwise active, then simple supportive care may help. Clear the nose if it is blocked, offer fluids, avoid smoke exposure, and keep the child comfortable. The goal is not just to stop the cough. The goal is to watch the child. So remember, a cough that gets worse at night can happen for simple reasons like mucus drainage, dry air, or sensitive airways. But it needs urgent attention if there is breathing difficulty, noisy breathing, poor feeding, unusual sleepiness, or your child looks unwell. And if your baby is very young, be extra careful. If you want clear, practical, doctor-led medical education for parents, subscribe to Clinic Explained, and in the next video, I'll explain how to tell the difference between a normal cold and a chest infection in children.